Welcome to the LIT show. Today is the first episode of this program. This is a program conducted by Dr. Raut's Center for Reproductive Immunology from Mumbai. I am Dr. Mohan Raut.
I'm Dr. Mugdha Raut.
We are practicing gynecologists for more than 30 years in Mumbai, and we have our own center, Dr. Raut's Center for Reproductive Immunology, where we treat patients with repeated miscarriages, unexplained infertility, and unexplained implantation failures using immunomodulatory treatments, including lymphocyte immunization therapy.
So LIT or stands for lymphocyte immunization therapy. As Dr. Mohan said, this is the first episode of the LIT show. The purpose of this show is to have an informal discussion about reproductive immunology in the field of repeated pregnancy loss, unexplained IVF or implantation failures, and unexplained infertility.
In this program, we will invite esteemed guests from different fields. We will have guests from the field of gynecology, field of infertility, doctors who are practicing IVF, the patients who have undergone reproductive immunology treatment, including LIT, and who have been benefited, and others who are working in this field of reproductive immunology, including our teachers, professors. So today, we have a very special guest with us, and I would like Dr. Mugdha to introduce her.
Yeah. So today's esteemed guest is Dr. Darshana Pawar from Nagpur. Dr. Darshana Pawar is an infertility specialist who has done her MRCOG from UK, and then she has taken her IVF training from Melbourne, Australia. Since 2007, she was in Melbourne, Australia. After having worked in also other 4 countries, she came back to Nagpur in 2010 and started Central India Fertility Center and Well Woman Clinic, which is a state-of-the-art infertility center with all facilities like IVF, IUI, ICSI, all under one roof. It is a standalone infertility center with no obstetrics and gynecological care. Pregnant patients, after her treatment for fertility, are referred back to their referring obstetricians and gynecologists.
So welcome, Dr. Darshana Pawar.
Thank you so much.
So let us start our informal discussion today. And the first thing we would like to know from you is, how did you come to know about the reproductive immunology and the lymphocyte immunization therapy and our center?
First of all, thank you so much for inviting me on this wonderful program. And I would like to congratulate Dr. Mohan and Dr. Mugdha, both of you, on receiving the prestigious award from American Reproductive Society, Immunological Society. Heartiest congratulations to you both.
Thank you.
Thank you so much.
I heard about LIT from you, actually. We were at ISAR conference in Mumbai, and Dr. Mohan and Dr. Mugdha, you both were giving a talk, one after the other. And I mean, it was like I had found God had sent me an answer to my problems, to what I could not do for my patients. And after your talks, I waited to meet you both. And I was so convinced that what you're doing is wonderful. And it will definitely help not only my patients, but patients all over the world who can come to your center and get the treatment done. So we met there, and I mean, it's an amazing work that you're doing. It's so wonderful. It's so selfless, and it is giving happiness to crores of patients that, are under your treatment.
Thank you, Dr. Darshana. But why do you think that this treatment is required or important for your patients, or for that matter, patients who are undergoing IVF? Why do you think it is important?
See, traditionally, we were taught unexplained infertility has no answer, but they are destined not to have children. I mean, though, of course, even now there are some very small percentage who may never be able to conceive. But then out of those so-called unexplained infertility, I realized that LIT was something is something we can do to help them. At least give it a shot. And when I came to India, I realized the kind of patients I was seeing in Melbourne and the kind of patients I see in India are very different. They are very, very different. Yes, earlier, probably this didn't take up much importance because surrogacy was very easy for people. So people went in for surrogacy. But since the surrogacy laws have become stringent, the women themselves want to conceive. Plus, every woman has a wish to become a mother herself. So I started looking for ways to help them. And as I said, your talk was a godsend for me. And because I was new in this city, people sent me the most difficult patients. People who had not conceived for years, 20, 21 years. Then patient who had 7, 8, 10 miscarriages. I had my own relatives who had not conceived. I had some close friends who had not conceived. So it was a very emotional time also for me to, help them. And it was so helpless. I could do nothing. So, and then I met you people. And that is the time I started sending patients to you. And you won't believe the blessings you and me have got from them. Because there are some who have been trying for years and years together. So it was a need of the hour. Let me tell you that. That what you have done at that time and the talk you gave, what pains me is people are still not aware. Gynecologists are not aware that there is some such therapy which can help. So I think we have to tell people that this is a therapy which does not need IVF afterwards. Even regular obstetricians, gynecologists who are seeing patients day in and day out can send their patients to you for therapy and then try natural ways, try IUI, not necessary to send to us for IVF completely. So this is what I want to convey today in our show today.
That's an amazing outlook, Dr. Darshana. And actually, we also in our initial practice face this problem of infertility, difficult to treat, IVF failures. Though we don't do IVF, we used to get patients who used to fail IVF. And then because we were working in this field of reproductive immunology, we started offering these solutions. And 7 years back, then almost 8 years back, we started our own center.
Right.
Yeah, we started our center with a launch where we had called Dr. We started our center 8 years back, and there we did a formal launch with the blessings of our teacher, Dr. Usha Krishna, and we had invited Dr. Ole Christensen from Denmark, who is a big name in the field of reproductive immunology. And he formally inaugurated our center. And that's how we started our own center about 8 years back.
Okay.
And then we started presenting our work in India, abroad. And that's how it started. We got good friends like you, good doctors who believed in reproductive immunology.
Absolutely.
And referring their patients. What I would like to ask here is, what is your experience? Can you tell me your experience of your patients?
Yes, absolutely. So I have so far sent about 26 patients to you, and almost 10 or 11 of them have conceived. One unfortunately miscarried again, but the others are continuing, and quite a few of them have had their children. So let me start with IVF failure. Now, people think IVF is the be-all and end-all of every infertility treatment, whether it is unexplained infertility or whatever. So I had this patient, a very close friend's relative. So somebody, I have known that family from childhood. So they have been married for 12 years. No, unexplained infertility, literally technically unexplained infertility, natural cycles, IUI, everything failed. She's 32 years old now, early marriage. And I didn't know what to do. So I told her, take a gap for a year. That is the time I met you. And after that, I had sent her to you. So in the meantime, I had done her IVF. 2 cycles had failed. Wonderful blastocysts, which even today are frozen with me. And then after she came to you, I told her, as you always advise, take a break of 6 to 8 months. She took a break of 8 to 6 months. And then Nagpur summer came in. So I don't really do IVF during summers. I take a break in May. And she comes to me in June, Didi, I have conceived. And I'm like, what? She's like, yeah. And I just saw her yesterday. She is 22 weeks. Everything is perfect. No complications, nothing at all. So she is one where I want to convey that do not rush for IVF after LIT. She conceived naturally. So her only issue was immunological, which was treated. And there was no need to do anything else. She has conceived naturally. Then there was this other girl who has again been a prolonged infertility. So most of the patients I have are 10 plus years of infertility. We had tried everything, multiple IUIs, no obvious cause, and she could not afford IVF. So I had not done IVF on her. And then I explained to her I showed her in fact one of your videos, which was there on Facebook. And she said, yes, I'll go and do it, since nothing has worked for so many years. So she came to you for LIT, and we did IUI again. And in the first IUI, immediately after LIT, she has conceived twins. Those twins are a year old. She just sent me pictures. The twins are a year old last week. So natural conception, IUI. And then of course, there are quite a few who have conceived with IUI after LIT. 3 or 4 to be precise. And 2 who have conceived naturally after LIT. Not 2. In fact, one of them is a doctor's daughter-in-law. One of them is a very well-known Indian person. So 2, my friends, Bhabhi. So these 6 of them have conceived naturally, and about 4 underwent IUI who conceived after LIT, and 1 I had to do IVF because there were other factors which needed IVF. She was not only unexplained. She was recurrent implantation failure due to other causes as well. So, these 11, 12 patients of mine, they have blessed you so much. They have blessed me so much. And so many of them are still in touch with you, because that is the beauty of your treatment, your immediate personal contact with them. You have given them your WhatsApp numbers. They message you. They are in touch with you. They send you their progress of pregnancy. They send you their baby pictures. So, it's like we are all like a family. We all are in touch. We know what's happening to them. So believe me, my patients are very, very happy with what we have given, helped them with.
Do you think they took this treatment? Was it very difficult for them, or was it they felt this was very tedious or very difficult to take treatment?
No, not at all. So when you gave me the permission to give them the number, so I tell them, you directly be in touch with Dr. Mohan. So they send you their reports. They call up and they talk to you. And once they've understood what LIT is, they are happy that, okay, now we'll go. Now, Nagpur, Bombay is not a big distance. So it is just, if they're coming by train, Duranto runs at night. So they take the Duranto the night before, they reach your center in the morning. All the facilities are there. They are very happy. They get, canteen is there. They get food, everything very easily. Their therapy lasts for 3 to 4 hours. Then you keep them under observation, and they take the night train and they are back in Nagpur next day morning. So they don't have to stay. They have no expense of staying anywhere. Food is easily available. So that is not an issue. People who come by flight, they take the morning flight, take the therapy. You make sure they are absolutely fine. Evening flight, and they are back home. So it is not difficult at all from Nagpur. It has been very easy. It has been very comfortable for them, because not only you, even your staff is so kind and so gentle with them that they are very, very happy coming to you. And the way things are explained to them. See, that is what, many people feel, humne bol diya, kar lo. No, they have asked you a million questions. I have asked you a million questions, because it is such a new thing. It is such a, you must be thinking I'm so stupid. But yes, in this, most of us have no knowledge. So it has been really, really very enlightening, not only for me, but even my patients have a different view of the whole thing. And the number of patients that have come through them, that, this is something which is very doable. very affordable. And the best part is you have given discounts to people who have not been able to afford. In fact, recently I showed your Marathi podcast to quite a few of my patients. She's a nurse. So she has seen it and she has said yes to me. So I will be sending her to you. And the thing is, non-affordable patients, you have given them a discount. So that also is a very, very big factor, Dr. Mohan. It is very, very important for many people who cannot afford it. And the reason they can afford you is because of this. And then they are convinced that yes, we will try IUI. They don't have to spend on IVF. That's a very, very big factor that patients are willing to come.
That's really nice of you, Dr. Darshana. And
it's a fact.
We really appreciate, because it is very important for a doctor to be open-minded, because to think about options, because if the doctor is patient-centric or patient-oriented, then doctor will always feel that what more I can do for my patient.
Very true.
Then you start looking for options, and sometimes or somewhere you will get a solution which will help the patient. And of course, indirectly, it is going to help the doctor also. As you said, these patients are referring more patients.
Oh, yes.
They are successful.
In fact, Dr. Darshana, I would like to say that you have a very scientific approach regarding infertility practice. What we have seen over these years is that whether it is a failed IVF or a repeated pregnancy loss, you go in a very stepwise manner. And that is the reason why that scientific approach, you have fitted immunomodulation or lymphocyte immunization therapy in that approach of yours, which I think also adds to the success greatly. So
that is all my to Melbourne IVF. Completely, totally Melbourne IVF. That's my training.
In fact, I was going to come to the second last question of this show. Is that, can you tell us a little more about this scientific approach which you have been doing, and about your center, and a little more, so that even we know a little more about you?
Okay. So my center, Central India Fertility Center, is in Nagpur, and I do only infertility. I don't do obstetrics. I don't do gynecology. So once they conceive, they go back to their gynecologist, the obstetrician. Even if they are from MP, they go back to their doctors. So, that's why I have this rapport with a lot of people here. And the best part is they do not interfere with my treatment. I don't interfere with their treatment. Like as with our patients, we are in touch with each other and we are looking after them collectively. So my approach is very, very simple. Start with hormones. I like to make sure their hormones are in level. So basically, it is our traditional teaching. Investigate both. I'm never in a rush to start ovulation induction just because the patient is young. So I start with proper history, that is MRCOG and my FRCOG training, and Melbourne. I mean, I'm indebted to Melbourne IVF and my bosses and my consultants, even my colleagues. I have learned a lot from all of them in Melbourne IVF. So all my thanks is to them, really. So I start investigating them. I like to do hormones for every woman who walks in. I've realized PCO is very, very rampant in India, which wasn't so elsewhere. And so I like to correct the high LH. Young patients, I definitely go natural for quite a long time. So female investigation, male investigation. Probably I'm still old school in going for HSG even today. I don't jump to laparoscopy very soon, unless age is a factor. When age is a factor, it's a different ballgame altogether. But now I've started getting a lot of younger people, a lot of patients who have been pregnant, married just for 2 years and are trying to conceive. So finally, I have, easier patients have started coming. So I do start with ovulation, even before ovulation induction, natural cycle and timed intercourse. Then I go up to ovulation induction and timed intercourse, provided other parameters are favorable. Then, of course, my next step is IUI. I do, if younger patients, everything is normal, I do go for 3 or 4 IUI. And if everything is normal, IUIs have failed, that is when I send to LIT.
Okay.
Yeah, I don't push for IVF before sending to LIT. If you would have seen, I have sent a lot of patients before IVF to you.
Yes, yes.
And after that, I would jump to IVF only if there are other factors, tubal factors, male factors. And when they fail, then again they come back to you. So in fact, I would say if of all my failures, LIT is my last stop.
Okay.
I think this is really a systematic approach, and that is especially important if you really want to be successful with the patients. Because here also, when patients come to us, we investigate them with certain immunological investigations to find out whether this lymphocyte immunization therapy is going to be beneficial for them. And
Right.
if investigations indicate, then we go ahead, we select the couple for therapy and then go ahead. And therefore, the chances of success are definitely better rather than just giving blanket treatment to all the patients.
Correct, correct. In fact, the patients come and tell me, Madam, हमने सुना है हमारे पूरे especially Chinwada and all, I have a lot of patients from there. So they come and say, हमने सुना है आप IUI में ही pregnant कर देते हो, आप जबरदस्ती किसी का IVF नहीं करते हो. So I take it as a very big compliment.
Yes, definitely, Dr. Darshana. That's a very big compliment.
True, very true.
And, actually, I now come to the last question of this episode. Is there any take-home message which you would like to give the patients?
See, I always tell the patients, first of all, trust in God, trust in your body, trust your doctor. If you are destined, you will get a baby. That's all I tell them.
Okay.
Now, in fact, I would like to ask you a question. You have asked me all these questions. It's my turn now. Dr. Mugdha, why don't you tell my patients about exactly what your center is, what you will do for them when they come to you? See, I have only the patient's perspective,
Right.
but I would love you to tell all of us how you would, deal with the patients when they are, even before they come to you.
Right.
What is it you want from them, from us as obstetricians or gynecologists? I'm hoping that obstetricians, gynecologists also start sending to you, not only us infertility specialists. So I would like you to really elaborate on what happens there.
So whenever the patient comes to us, like many patients still do not know if this therapy exists. What is this therapy about? So what we have been doing, since we get patients from out of Bombay also, for patients from Bombay, they come to our center, have a consultation with us. We explain to them everything, what could be the causes and how alloimmune factors or immunological factors play a very major role in repeated pregnancy loss or IVF failures and unexplained infertility. For patients who are out of Mumbai, we do a video consultation also. We do a WhatsApp video consultation. As you say, we try to keep it as simple as possible because WhatsApp is easily available everywhere. So the patients even see us and they know about us a little. Then after that, once we tell them about what investigations can be done. Now here is what patients have a little bit of worry is, that means, do we have to come to Bombay to do all the blood tests? Do we have to stay there for a week? So we have a collaboration with certain laboratories where we get the test done wherever the patient is.
Correct.
To a home visit, or they go to the nearest center. We have made a package because otherwise these tests done individually are extremely expensive.
Yeah.
We have created a package which is going to help the patients in the long run. And this package gives it at a little, much lesser cost than the individual test.
Okay.
Now,
approximately how much would that package cost?
It costs around 10 to 12,000. And plus we need, once the patient is sure about the therapy they want to do, we need a fresh infection profile done with a special technique like ELISA or CMI, so that we get it done at that time then. And then the beauty of technology today is that once these reports come, they not only come to us, they can also go to the patient. So then we can arrange another video call with the patient, explaining each and every aspect of the treatment of the test, what is the meaning of the test, where we get to explain to them, and then we book this for treatment. Right. Now the date for the treatment. The treatment is usually is not is not affected by any time in the menstrual cycle or any particular day. It can even be done in pregnancy. In fact, we had one patient who came to us who was just pregnant, and she said, "Will you wait for me to abort again the 7th time before you do this therapy?"
Okay.
So, because it is done abroad, many centers abroad are doing it. So we did it, and today she has a beautiful 2-year-old daughter.
That's wonderful.
Now we have a lot of series of patients where we can even do it in early pregnancy, and we've had very successful results. Now the therapy, which even if they have to come to Bombay, the therapy, as you know, lasts for only 3 to 4 hours, and it is only done as a single sitting. The patient doesn't have to come for multiple sittings. So this is a therapy which we have upgraded, and the technology which we have done, and we have applied, we have patented the technology. So here we can give a service of a very good quality where patient requires the therapy only once. So they need to come to Bombay only once. And as you said, everything is arranged for them, including the food. And if some patients, there are some patients who want to stay in Bombay. They want to have a look around Bombay. Before the lockdown, they wanted to little move around in Bombay and all. So we are even partnered with someone who helps them about where they can stay, and when they want to travel, where they should travel. So our travel partner takes care of that. So that means now with the lockdown, yes, patients don't want to stay in Bombay for a long time. So this is what and then the therapy which is done afterwards. The passive immunomodulation, we generally discuss with the doctor, like we have always told you what we should do for this.
Exactly.
And what more we can do, and what other medicines, or so that patient can do, like patient is your patient, you can do it in Nagpur itself. So again, you don't have to come to Bombay. So we do the lymphocyte immunization therapy. And as per the patient requirement, we give the suggestions to the referring doctor.
Right.
The referring doctor further does the further treatment.
Right.
And if they have any challenges, we always discuss with each other.
Yes, yes. That I have been troubling Dr. Mohan all the time. So my one more question is, now suppose we do the therapy and she is suppose unable to get treatment done, or she doesn't conceive. So how long would be the validity of this LIT that we do? Is there a time frame?
Usually the effect, what we have seen is the effect lasts for almost 18 months.
Okay.
So preferably we ask them to conceive or plan pregnancy within 1 year. But we have seen up to 18 months the patients are successful. Beyond that, we have patients who have failed, and there are a few patients who have taken LIT second time, because after first successful pregnancy, second time they planned and they could not succeed. They took LIT second time, and second time they had successful pregnancy.
Right. I was going to ask that. So for second baby, they have to, I will send them back to you.
But not all. See, we have patients who have just conceived, and second time also they have, without think they have done well. But some of them did take second time, and they have really done well.
Okay. Yeah, that's wonderful. I mean, what made you go into reproductive medicine, into this immunology, consultation? We all are always away from immunology and such things.
Right.
How did you get into this?
Because the immunology was a subject in second MBBS was to be kept aside.
Exactly.
So, actually, it is interesting because this has gone long back, more than 25 years back, when I had just completed my residency and Mukta was in a residency. Her boss, Dr. Usha Krishna, was involved in a research project with Oxford University, and she was someone who had some time to be associated with it, who has done his or her MD. And so she asked me whether I can join. So I became a part of that research project related to LIT. And it was over, we continued doing it. And then since last year, we have our own center where we have done these therapies, modified it, and even applied for patent. So, and the satisfaction that we get from one patient,
absolutely,
for second patient, and this way it has gone for now more than around 12,000. We have 1,200 lymphocyte immunization therapies we have been associated with, and with excellent success.
Wonderful. So it's indeed a very noble research you've gone into, no doubt about it.
So, in fact, I think now we will come to the end of the LIT show. We are extremely grateful to you, Dr. Darshana Pawar, for taking some time in your busy schedule and giving us your experiences with lymphocyte immunization therapy and reproductive immunology in general.
Thank you so much. Thank you for inviting me for the show. Thank you so much.
So we would like to tell our viewers to definitely, if you have any comments, please put your comments so we can reply them. And definitely do not forget to follow us and look for more episodes. We'll soon be coming with our second episode of lymphocyte immunization therapy. So stay tuned. And don't forget to click the share button, because we don't know, your one click could help one couple have a successful pregnancy.
Very true, very true.
Thank you very much.
Thank you so much. Thank you.
Thank you, Dr. Darshana, and thank you all.